So good morning, everyone. And let me first just begin by thanking our speakers. I think they've set the stage really well for this further discussion that we're going to have in this panel group. I am absolutely delighted to introduce the people that we've put together to have this conversation. So Catherine and Abe, you've met already. We have Harry Thallapalli, who is the CEO of CallHealth. That's a startup based in Hyderabad that is creating an interface for bringing together virtual and physical healthcare services. So we talked a little bit about government's problem with the private sector. Harry, you are an entrepreneur. I would like you just to tell the audience a little bit about what you do, and then just comment on what are your problems with government.
Well, to begin with, I think I have to put a disclaimer, and the disclaimer is that I'm new to healthcare. I've been in healthcare only for 3 years. Prior to that, for about 30 years, I was in technology services. So the good news is I know very little. And the bad news is I know very little. And so here comes a completely outside-in perspective to what is going on, and to set the context of what Abhay and others were talking about. India's healthcare spend is about, 4% of the GDP. Of that, 1% is from the public or the public sector spend, 3% is the private sector spend, right? So obviously it is 3 times more prevalent. We don't have enough infrastructure. And to add to it, the government has chosen to move away from being a provider and has become a purchaser or a payer. I mean, now, I don't know if some of you are aware, we are talking about covering 500 million lives as part of the latest insurance program. What is the coverage we are talking about? About $8,000 annually for a family of 5. So the government has decided that for a country of 1.2 billion people with the kind of complexities that we have, trying to put together an infrastructure is not going to work very well. The ambitious plan of growth is to hit about 2.5% of GDP by 2030. So it's a long way away from what the need is. Yet, at another level, India's, if you look at the specialists and medical services and capability, 70% resides in urban cities, the 6 urban cities primarily, and probably about 30% is for the rest of the country. Now, what that means is that there is a dramatic level of asymmetry that exists between the need and the availability. And here is where people like us come. And so let's look at it. There are only 2 players in this whole drama, right? On one side, you have the patient who is looking for access, who is looking for affordability, and who is looking for high-quality service, safe and effective service, clinical outcomes. On the other side is obviously the entire ecosystem of government, the private players, the clinicians, the works. And what are they looking for? Obviously, they're looking for capacity optimization. They're looking for ability to have some level of, I would say, some kind of regulation that allows them to do things and not in a restrained way or a constrained way, but beyond. And where does technology come in? And that's where I come in. So we are a company called CallHealth, which saw the need and the opportunity being very, very high. And we know that in the current pattern of medical professionals being churned out, India will never be able to really meet its needs for the next 15 to 20 years. And to take Kathy's question forward as to how do you look into the future is where we came in. So we said, let's leverage technology to bring about a change in the healthcare ecosystem. And every other ecosystem has managed to do it. You talk about transportation, travel, e-commerce, everywhere. Technology has brought in dramatic changes into collective consumerism. Whereas when it comes to healthcare, we continue to operate in a very, very traditional way. And I'm talking about healthcare services. There is obviously phenomenal advances in technology when it comes to diagnostics and treatment and surgery. But when it comes to access to services and ability to disintermediate layers, technology has not played a role in this place. So what does CallHealth do? Or what do I think technology companies and private companies can do is to actually wireframe the entire system that we can enable access to healthcare for people in remote locations or in far-flung locations where it's not available, and bring forth faster and easier access at their convenience. So I think that's something that has been missing, and we believe that's one of the things that CallHealth does. Another thing that we think we will need to do, and that's where we are headed out, is Abhay put it very subtly, I think, when he said there is kickbacks and corruption. And I can only say that since I am an outsider into this industry, I was appalled at the level of, if I may say so, indulgences that were happening at all levels. And one of the things that we have done is to disintermediate layers by saying that we could actually work with the diagnostics labs and the pharmacies and bring down the cost by almost 50 to 70% compared to what it was in terms of a rack rate. Now, why is an MRI today charged at $100 in India, when today after we have come in, we have been able to bring down the MRI cost to about $50. And that's purely because there has been a layer of gratification that has been happening in different pockets. I'm not saying this is all prevalent, but please do recognize that that has been happening. So we have been able to bring in a digital layer and reduce the whole dependency of a payback that has to happen in different sense. So that's where we have managed to do. Technology can bring forth a change in the way access and in the way costs can be brought down as we go along.
Thanks, Harry. So that's, I think that's such an interesting perspective about how technology can help to structure markets in a way that might make them work more efficiently. Harry, you could comment briefly on the data issue, but also, what do you need to do going forward to think about how we structure a system that can engage the private sector in a constructive and effective way?
So I think one of the biggest advantages that technology will bring is transparency. And when I say transparency, it is the ability to trace evidence-based medicine, whether it was followed or not. It is the ability to move from a very curative, episodic engagement with the provider or the clinician to a continuum of care. And to answer the other question around data, we just covered 100,000 tribal students in remote places. We did a health screening, and we now are providing a 24/7 one-year care for them in terms of treatment. I believe that has been possible because we've been able to bring together all the pertinent information and make it available in interesting dashboards and perspectives. So one of the biggest things that I'm going to kind of advocate for is probably a singular regulated system around the EHRs and the EMRs, and to have probably a tighter focus towards interoperability of processes between the different players in the healthcare ecosystem. But there is nothing more powerful than having transparency of data and information, which can make decisions and traceability and auditability a much easier task as we go forward. So I would just vouch for that and leave it at that.
Okay, thanks very much. So please join me in thanking my spectacular panelists. And with special thanks to Abhay and to Catherine for setting us off on such an interesting discussion. Enjoy your coffee.